so I'm not recording it, it's all going back to TOC.
Oh, okay.
Is that where you've been grabbing it?
Yeah, and then sometimes I just get it directly from their page too, from their Facebook.
Yeah, okay. Well, cool, how you doing?
I'm pretty good. How about you?
All right.
That's good.
Yeah, so I just checked for TOC and
Okay then.
yeah.
All right, simple enough, right?
Yeah. Oh yeah, once I didn't know that. So these guys are helping me out.
Yeah, I don't know anything about how that all works.
Well,
So I can master new, but basically, if you check the
Okay.
books at first, my
Sounds good then.
no, I can do this first, my house first, mine.
Ready? Well, good. Well, welcome, everybody. Thank you for joining us this afternoon for a State of Colorado COVID update. You might notice that everybody else on the panel here has a white coat. That means they've been through many years of medical school. Is it 4 or 5 years of medical school? And then they go do a 2-year or 3-year rotation as a fellow, and then I think if you go into a specialty like pediatric infectious disease, you probably do another one. I don't know how you're so young, because you must have been like getting to be a doctor and a specialist in pediatric infectious disease. That takes so much time. You know, one of my best friends from high school became a doctor, and I mean, he, you know, just took so long and so much work. So we have 3 great doctors here today. You know Dr. Rachel Herlihy, our state epidemiologist. You know Dr. Eric France, our chief medical officer for the state of Colorado. We are also joined by Dr. Chuchita Rao, a very prominent pediatric and infectious disease specialist at Colorado Children's Hospital. She's also an associate professor of pediatrics at the University of Colorado. As you might have guessed by her presence, we're going to talk about COVID in kids and how important it is, especially that parents of kids 12 and up get their kids protected to help end this pandemic and make sure that your kids stay safe. Before we get into the vaccine and how to best protect your kids and yourself against the virus, I want to walk through some of the numbers. 952 positive cases yesterday. Hospitalizations continue to go down. We had 516 hospitalizations. That's a decrease of 5. That's still a relatively high number, and just to put that in perspective, that means that 516 of our fellow Coloradans are currently in the hospital being treated for COVID. And we have lost 6,618 of our fellow Coloradans due to COVID in the year of the half of the pandemic. And I express my condolences to the family members, the loved ones of everybody who's experienced loss. Cases and hospitalizations are down in most counties. We are seeing sustained high levels in southern Colorado, El Paso County, Pueblo County. But behind the numbers, here's what we're seeing, and we'll talk about today. We're seeing a lot more people, young people, being admitted to the hospital because there's lower protection numbers with the vaccine. It really is just remarkable how effective the vaccine is. So we're seeing so many more people 30 and under, teenagers, 20s in the hospital, and so many less in their 60s, 70s, and 80s. Where we have very, very high vaccination rates in the state of Colorado. So the main takeaway from that is, of course, vaccines work, and if you're in your 20s and 30s and you don't want to go to the hospital for a week or two, and it's a grueling experience to have to do that and put yourself through, then just take 15 minutes and get vaccinated. It's worth it. It's free, it's quick, it's easy. 2 main pieces of advice for all Coloradans. One, if you're experiencing symptoms, cold-like symptoms, temperature, cough, any of the symptoms, just get tested. Very important. And if you're tested and you're positive, quarantine yourself, keep isolated so that everybody else doesn't have to quarantine yourself. It's just a big deal if you can get tested if you have symptoms and take the steps to avoid passing it to others. Second one, if you haven't yet been vaccinated, please get vaccinated. And that's a message to every Coloradan age 12 and up. It's available free, quick, and easy for you. Your local pharmacy, your local hospital, your community health clinic, the large sites, like I was over at the Ball Arena, formerly Pepsi Center yesterday, the Ranch in Loveland, Dick's Sporting Goods I was at, the Broadmoor World Arena, Colorado State Fairgrounds, so many easy ways to do it. And we're making great progress. I'm particularly proud of Coloradans. As you know, last week, adolescents 12 to 15 years old were eligible for the Pfizer vaccine. We've already successfully vaccinated with the first vaccine 11% of all 12 to 15-year-olds in the state of Colorado. That's good for 1 week, but it also means we have 89% that haven't yet been vaccinated. So we have to keep up the pace over the next few weeks. We have plenty of Pfizer vaccine on hand at all of those major sites and most major pharmacies for the 12 and up to be able to do that. The Moderna and the Johnson & Johnson are approved for age 18 and up. We also, just to sort of talk about the level of difference of vaccination between different age groups, and where and what at age 30, over age 30, 2/3 of Coloradans have gotten at least 1 dose of the vaccine. 16 to 29-year-olds, only 44% have gotten 1 dose. And so that's the reason we're seeing more young people in our hospitals, is because less are vaccinated. And people of all ages, if you haven't found the time to get vaccinated yet, please do so. As we move out of the sprint of vaccinating those who are at greatest risk into the marathon of vaccinating those who've been waiting for it to be convenient, those who've been putting it off, we're shifting our focus, and we'll be issuing the guidance today, from not wasting a single dose and using every dose within 72 hours, which was our focus when we were supply limited with a vaccine, to instead not wasting a single opportunity to vaccinate. We want to make sure that even if there's only one patient on hand to receive a vaccine, that the vial is punctured and that vaccine is given. Our partners will now be able to have the vaccine up to 2 weeks instead of the 72 hours to make sure that they have it on hand. And we want to miss no opportunities to vaccinate somebody, even if it means puncturing a multi-dose vial to administer a vaccine without having people lined up to receive each dose. We are adopting this CDC guidance here in Colorado because we want as many people as possible to receive the life-saving vaccine, and our supply level now allows that. In the early days, we were very concerned with getting every dose into an arm as quickly as possible. Now we are more concerned with finding and getting it to the remaining people who are unvaccinated, and that's okay if a dose isn't used in 72 hours, and that's okay if the vial is punctured for one patient, because it really at this point is inexcusable to deny somebody the vaccination simply because we don't have enough people lined up for every dose in the vial. So that guidance is going out today, and that should help us particularly in rural areas, in small, low-volume clinics to do 1 or 2 out of a vial to make sure that everybody has access to the vaccine. I'm now going to turn it over to Dr. Herlihy to walk through the trends, particularly the trends of COVID-19 among young people in our state. Dr. Herlihy.
Thank you, Governor. Good afternoon. So I'd like to provide an update on Colorado's trends with a focus on what we're currently seeing among children and adolescents in the state, as the Governor mentioned. So this figure compares case rates among adults, 18 plus, middle and high school students aged 11 to 17, and preschool and elementary school students ages 3 to 10. The great news is that for another week, we have continued to see a decrease in cases among all age groups in the state. And I believe that this is a result of vaccination rates rising in Colorado. We're seeing direct protection for individuals who have been vaccinated. And that shows up most clearly in our adult data that's being seen here. But we're also seeing a decline in some rates among younger children. And we believe that that is probably indirect protection that is coming from parents and other adults that are around those children being vaccinated. And so the goal that we have in mind here is get to a place where we have enough protection for individuals who are not yet vaccinated from their community. And so we have obviously now vaccination available to a growing percentage of the population, with vaccine available to 12 to 15-year-olds in addition to the 16 plus where vaccine has been available for months now. So obviously good news, and we continue to see this decline. But we do continue to see that highest rate of disease among middle school and high school students, and this is really where we have the greatest opportunity. We need to see increased vaccination rate among those individuals to protect them from infection. And also for those younger populations that are not yet eligible for vaccination, it's important that parents continue to take precautions for those younger children to protect them from infection. Next slide. I also want to share the latest testing trends with you. So this figure compares percent positivity data by age group, or what proportion of tests come back positive by each age group. We have long had a goal of reaching 5%, below 5% positivity in the state. So 5% is a level that signals to us that transmission rates are low and that we are identifying a high enough proportion of cases to understand how much disease transmission is occurring and make an impact on disease transmission through our case investigation and contact tracing work. So you can see now that we are below 5% when you look at 18-plus-year-olds. So that adult population, we're where we want to be. We obviously would love to see that come down even further, but we're below that 5% goal right now. Unfortunately, for younger kids, we continue to be above that 5% mark. And so to me, this means that we're really seeing cases go undetected in our pediatric population, meaning that we're really not detecting as many cases are occurring, and when we're not detecting those cases, we're not intervening on those cases and disrupting transmission. So of course, vaccination is going to continue to be the most important way to prevent ongoing transmission of disease, but after that comes testing, and testing is a really important way for us to interrupt transmission and prevent additional cases from occurring. Next slide, please. So the next two figures show you data on pediatric hospitalizations in Colorado. Over the last few weeks, we've been sharing with you that this fourth wave has been much easier on our adult population. Vaccination rates have been increasing, and because of that, fewer than half as many hospitalizations have occurred recently compared to what we saw in our fall wave of illness. But in contrast, if you look at the numbers here for April for Colorado's pediatric hospitalizations, you'll see that that number isn't too far behind what we saw in our fall wave of illness, meaning that we're continuing to see high hospitalization rates among our pediatric population. Next slide, please. And finally, this figure shows you COVID-19 hospitalizations broken down in two different age groups. Those that would now be considered vaccine eligible, so those 12 to 17, and then those who are not yet vaccine eligible, so those 0 to 11 years old. About half of Colorado's pediatric hospitalizations that have occurred in the last couple of months, even more than half in some instances, would now be considered vaccine preventable. So COVID-19 is a vaccine preventable disease now for most adolescents. Adolescents who are eligible for vaccine should receive it as soon as they can, and parents of children who are not yet eligible for vaccine should continue to take precautions for their children. Thank you.
Thank you, Dr. Herlihy. And of course, while kids as a whole don't get as ill or have the same fatality rate as older folks, we have seen too many hospitalizations, and tragically, we have seen several deaths reported in Colorado among the youngest Coloradans, including several in the age group that are now fully preventable with the vaccine. For younger Coloradans, 2 doses of the life-saving Pfizer vaccine delivered over about a month can bring an end to over a year of forced social isolation and illness and help us return to normal. And for all of us, this means that we can feel more secure as we continue to go about our summers. And that's why today I want to talk to you about what we can do to protect our children. We are excited to work on Protect Our Children with Colorado Children's Hospital, and we're going to work hard between CDPHE, Children's Hospital, and many others to provide parents the tools and steps that they can take to protect our children from COVID-19. First and foremost, parents and adults should get vaccinated if they haven't been vaccinated already. Second, get your kids vaccinated. If they're 12 and up, take a moment and get it done. You can do it at your local pharmacy, one of our drive-through clinics, at Ball Arena, Dick's Sporting Goods. You can do it at your doctor's office, your hospital, your community health clinic. And for those who aren't yet fully vaccinated, and that includes those who aren't yet eligible to be vaccinated, 5-year-olds, 10-year-olds, wear a mask when you're around others indoors, especially around others who are unvaccinated. Last week, I announced a modification to our state mask guidance to align with the new CDC science-based guidance that was issued last week. And with increased vaccination rates and no current threat to hospital capacity, the state's role in requiring statewide restrictions is thankfully no longer needed, but now it's a matter of individual responsibility to keep yourself, your kids safe. And that's very much the focus of Protect Our Children. Every unvaccinated Coloradan, 12 and up, has a variety of opportunities to get the life-saving vaccine, protect themselves from the virus, and help end the pandemic for them, and do their part to help end the pandemic for the rest of us. Getting the vaccine should be as easy as visiting your doctor for a checkup, visiting your local pharmacy, one of our drive-through sites. Primary care providers are very important and trusted sources of information, and we're really calling upon all of our pediatricians, family practices, and private practices to make sure that they offer the vaccine to their patients when they come in for regular checkups or for any other type of issue. And in order to meet Coloradans where they are, we're continuing to build stronger partnerships with primary care providers that serve communities across our state. These partnerships are even more important now that children 12 to 15 can get the vaccine through their pediatrician. Primary care providers everywhere in Colorado can enroll today as a vaccine provider. So if you're a pediatrician or family practice and haven't enrolled yet, we can get you the vaccine within a few days. We can get it to you any day you need it, whenever you need it. And you can enroll right away to do that. If you're a provider that's interested in offering the vaccine, you can email cdphe_COVIDvax@state.co.us to get enrolled. You know, while years of research and groundbreaking science, and as well as the clinical trials with tens of thousands of people, show us that all 3 of these vaccines are highly effective and safe. Details surrounding how the vaccines work and how the protection works that they provide and what an immune response is and isn't aren't necessarily common knowledge, and that's why we want to have some experts here today, because no question is too small or too large to get answered, And we don't want a lack of information or inaccurate information to stand in the way of you getting this life-saving vaccine that could protect your life and the life of your loved ones. And that's why we have Dr. France and Dr. Rao with us today. They're straight shooters. They earn their white coats with years of study. They've seen many patients, and they've made this particular issue, COVID and the vaccines, a major part of their learning over the last year. So Dr. France, maybe you can, at an introductory level, how do vaccines even work? How does this all happen?
It's really important that people understand the basics of vaccines so they feel like they can trust what we're doing. And vaccines really take advantage of our body's immune systems. And immune systems are in ourselves to fight off any virus or bacterial infection that can happen. So when you become infected with a virus, let's say chicken pox, you get quite sick. Your immune system is trying to fight off this virus, giving you fevers, and you may have a rash. And then once it's gotten to know that virus and has successfully beaten it down, you're now protected from getting chicken pox again. So your immune system understands how to fight chicken pox, and it does the job. We do the same thing with vaccines. We say, okay, let's take a virus or a bacteria and only a small piece of it, a piece that actually can't cause you to get sick, and introduce it to your immune system. Your immune system sees it and fights it, gets to know it, and then over time is ready to fight the real thing should you become infected by a virus or bacteria. So for the COVID vaccine, we present your body with a recipe. It's a recipe to make a small protein from the surface of the virus. And the first time, with your first shot, this recipe is presented. It causes some fevers and headaches and fatigue. The second time we present it with you for that second shot for 2 of our vaccines, you have even more of a reaction because now your immune system is recognizing this and it's learning what this protein looks like. And now you're ready, you're vaccinated. And so if you actually in public get exposed to this virus, your immune system is there and it's ready to attack and prevent the infection caused by that virus. The end result is that these vaccines are 95% effective at preventing you from getting sick with the COVID virus.
Thank you. And Dr. Rao, given that, kids 12, 13, 14-year-olds are not as much at risk as people in their 30s and 40s, and certainly not as much at risk as people in their 70s and 80s, why should kids 12 and up get vaccinated? Why should their parents make sure to get them vaccinated quickly?
Thanks, Governor. Well, I think it's really worth us taking a moment to think about the children and the adolescents who have had to endure this pandemic along with the rest of us, who've had to either battle infection themselves, have dealt with the loss of loved ones, have battled missed school, navigating online learning, and have endured a lot of mental health issues, including anxiety, depression, and feelings of isolation. And so that's why we as the pediatric community were so elated to hear the news that was going to help to bring these children and adolescents just one step closer to a more normal life. So as you all know, on May 10th, the FDA authorized the Pfizer vaccine for use in children and adolescents 12 to 15 years of age. And then 2 days later, the CDC's Advisory Committee on Immunization Practices, which is comprised of vaccine experts from across the nation, reviewed the same data and approved its use. So it's worth emphasizing that the FDA, as well as the Advisory Committee on Immunization Practices, evaluated every COVID-19 vaccine study through all of the phases through a very rigorous, transparent process prior to this authorization and recommendation. And then to help make this decision, they reviewed data from a study that evaluated whether children and adolescents 12 to 15 years of age could be included in pandemic COVID-19 vaccination programs. So just to tell you a little bit more about the study, it included 2,260 participants who were 12 to 15 years of age, and they were enrolled in a randomized placebo-controlled clinical trial. Half of the trial participants were given the vaccine and the other half were given the placebo, and the results were absolutely outstanding. So the study showed that the vaccine was 100% effective in preventing COVID-19 disease in the 12 to 15-year-old age groups. And there were no infections in the group that received the vaccine, and about 1 in 50 children in the placebo group became ill from COVID-19. So note that this trial is still ongoing. There's going to be at least 2 years of follow-up to be able to evaluate just how long this protection is going to last. So the vaccine was shown not only to be very effective, but also to be very safe. So there were no serious safety concerns. There were only mild effects after receiving the vaccine, and those were commonly things like headache, fatigue, chills, and some body aches. And those were seen a little bit more commonly after the second dose compared with that first dose, and they resolved after a day or two, like what we've been seeing with adults. The trial also found that vaccinated children and adolescents developed strong protective immunity, and that's also really important to keep in mind. So the reason why the timing of this authorization is so important is really data that you've heard from Dr. Herlihy, and then also national data telling us that people who are under the age of 18 are now accounting for close to 1 in every 4 newly reported COVID-19 infection, which is really a very concerning statistic. There have been 3.9 million children and adolescents in the US with COVID-19 infection reported to the CDC. And then even though this is a lower volume of infection than what we are seeing compared with, say, older adults, I mean, it's important for us to remember that they can still get sick from infection with this coronavirus. They can still go on to infect others, including those who have weakened immune systems, people of older age groups, and those who may not be able to receive the vaccine yet, such as younger siblings. And it's also important to remember that some children and adolescents can get very sick. And of those who end up being hospitalized, we have seen a large contribution from adolescents. There have been several hundred deaths reported nationally from COVID-19 infection in children. And then we still continue to see the rare complication of COVID-19 in kids, which is multisystem inflammatory syndrome, or MIS-C, which is a shock-like infection associated with COVID-19, in which different parts of the body can become inflamed. And more information is emerging about some of these reports of more long-term effects from infection in children. These are also known as long COVID or PASC. So I also want to mention that one of the unfortunate effects of the pandemic has been the decline in routine childhood vaccinations, and we've been seeing this in Colorado. So our rates are slowly starting to pick back up, but we still have some ways to go. So given how important routine vaccination is, as well as the need for rapid uptake of COVID-19 vaccines, the American Academy of Pediatrics just put out a statement approving that these routine immunizations can be given at the same time or around the same time as the COVID-19 vaccines. And so I do urge families to get their children caught up or to get the vaccines that are due. Now, at Children's Hospital Colorado, we encourage parents to get their children 12 years of age and older the vaccine as soon as possible. Now, it's understandable that families are going to be asking a lot of questions around the vaccine and considering what to do for their families. So I just want to emphasize that while these vaccines are new, this type of vaccine technology has been around for decades. And unfortunately, misinformation and myths can spread more easily than the facts. So I'd recommend that families turn to their trusted sources of information as pediatricians, as well as other primary care providers who know a lot about how vaccines work and about vaccine safety. And I just want to finish by restating that this is really exciting news that we can now provide to our tweens and our teens a safe and a highly effective vaccine that can do a lot of good, not just for the individual receiving the vaccine, but it's something that can help make life safer for you as a family and for your community at large. Thanks a lot.
And so you're saying now they can get that along with if they have a regularly scheduled tetanus or measles or some other shot, they can get the COVID one at the same time?
That's
they don't
correct.
have to come in twice?
They
That's
can get
great.
it at the same time.
Dr. France, so I've been vaccinated. All of us have been vaccinated up here. That's what, you know, why we're not wearing masks and we're very safe. Can I or you or others who have been vaccinated still transmit the virus to those who are unvaccinated, including kids?
Yeah, I could see people would be worried or concerned. I'm vaccinated, I have children in my house. Are they at risk if I actually have an outbreak case and I become ill? Good news is that the virus in my body, the amount of virus is lower if I've been vaccinated. And if my virus is at low levels, I can't spread it nearly as much as somebody who has not been vaccinated and when they're sick has very high levels of the virus in their body. The other thing about vaccination is that it reduces the length of time that I can actually be spreading the virus. So not only are the levels lower, but the period by which I am infectious or likely to spread it to others is shortened. So the important point here, of course, is that all parents should be vaccinated. That will help protect your child. And if you think about the younger children who can't be vaccinated, anybody who's around them should be vaccinated as a way of protecting them. That's a well-known strategy in vaccination that we call cocooning. When a child is too young to receive the vaccine, we vaccinate everybody around them so that they are protected from the disease. So please get vaccinated. There's a very small chance that you could spread it to a child or a family member, but it's still much more important that you protect the whole family and community through vaccination.
Another question we get asked a lot is there a cost associated with the vaccine? And the answer is no, it's free for everybody. In fact, you might even get a free shirt or a gift certificate, or I think Abe Basin offered bacon margaritas. You know, personally, I would get a shot to avoid having a bacon margarita, but apparently some people like them. So yeah, no, it's totally free. Doesn't matter if you're insured, if you're a resident, if you're young or old, no cost, and you know, you might get some swag wherever you go. I think there's a place I visited yesterday. T-shirts they were giving away, another one was giving away 5,000 miles on Southwest Airlines. So it costs you, nothing is the most it'll cost. You might actually make a little profit out of it. You know, Dr. Rao, what have you seen about long-term effects of COVID? Because I get so frustrated when people say, I'm worried about long-term effects of the vaccine. And obviously, what you should be worried about is long-term effects of the virus. Because the vaccine, you're done in a day or two with any effects. But what are you seeing about long-term effects from the virus, especially among kids?
Yeah, it's such an important question. So we have been seeing more information about what's known as long COVID or long haulers or post-acute sequelae of COVID. In adults, we're starting to see that up to 30% of people can have some ongoing, lingering effects of COVID. A little bit less is known in children, but some of that data is starting to emerge. And so depending on the studies that are coming out now, anywhere from 10 to 30% of kids can also have some of these long-term sequelae. So I think that's a really important point, that it's not just about getting an infection and getting over it quickly. Some people can get long-term effects. People worry about the long-term effects of the vaccine, as you mentioned, but it's much more likely for you to get long-term complications from the actual infection itself than from the vaccine itself.
You know, and Dr. France, if someone has chronic health conditions, should they get the vaccine?
Absolutely, they should get the vaccine. As a matter of fact, it's those with chronic medical conditions that we're most looking to get vaccinated. If you have a chronic medical condition, if your child has a chronic medical condition, there is a risk of severe complications from COVID infection. So you are a priority for us and for both you and your family. Please be sure you're getting vaccinated.
Dr. Rao, another question I get is, what's the difference between EUA and FDA approved, and what does that mean, and should I care, and should that affect my decision about whether to get vaccinated?
Yeah, so it's important for folks to know that the EUA is actually a type of approval that goes through the FDA. So EUA stands for Emergency Use Authorization, and it's a specific type of approval that the FDA uses to help facilitate the availability of medicines, of vaccines, of diagnostic tests during public health emergencies like the COVID-19 pandemic. So under an EUA, the FDA is still going to take into account the totality of the scientific evidence about a vaccine, and so it's going to make sure that they still have the same number of participants that are going to be involved in some of these clinical trials. They still have a very rigorous process to make sure that these products are going to be safe. And they also require a plan for active follow-up too. So once these have been approved, they're going to still continue to look at the safety, to look at various outcomes, and then other adverse events as well among individuals who receive the vaccine, to really just help with informing that ongoing risk-benefit determination to support the continuation of that EUA.
And Dr. Rao, is it safe for pregnant women to get vaccinated? I mean, is it safer to get vaccinated, or is it safer to risk getting COVID if you're currently pregnant?
Yeah, so we know that pregnancy is actually a risk factor for having severe COVID-19 infections. So some reports are stating that there's an increased risk of ICU admission, of needing to be on a ventilator, needing to have additional heart-lung support with what's known as ECMO, as well as death. There have also been reports in pregnant women showing an increased risk of things like preeclampsia, eclampsia, as well as preterm birth. And so what we know is that protection of pregnant women is not just going to help them, but it's also going to help their baby. And so there are now starting to be some studies and some emerging evidence about the safety of these vaccines in pregnancy. So these are through some active surveillance mechanisms such as VSafe or the passive surveillance networks like VAERS that are showing us that receiving the vaccine during pregnancy is very safe, both to the woman and to the baby as well. So I also want to iterate that the Advisory Committee on Immunization Practices has also endorsed this as a very safe thing to do for pregnant women.
Thank you, Dr. Rao and Dr. France. I know that many Coloradans have questions about the life-saving vaccines. That's one thing we hope to address through the Protect the Children effort. And if you post your question below, we'll do our best to get you an answer. Since the Pfizer vaccine was recently approved for Coloradans aged 12 to 15, I know that many parents across the state are wondering about the best step to take forward for their child, where they can get it. My own kids are 6 and 9. They're not yet old enough to get a vaccine, but if they were, I get them vaccinated as quickly as possible, especially with all the information that I've seen. To talk more about what the vaccine means for younger children, we're joined by Dr. Rao from Children's Hospital. She's going to give an overview of the Pfizer vaccine for kids 12 to 15 and steps that parents and guardians can take to protect their family. I want to thank Children's Hospital, one of the first major providers to jump at the opportunity to protect children. They began signing up 12 and up before it was even approved, getting ready for the Pfizer vaccine's authorization. And because of that effort, and the extreme efforts of all of our major providers, community health partners, and equity teams and volunteers, over 57% of Coloradans have gotten their first dose, 11% of kids 12 to 15 just in the first week. I'll now turn it over to Dr. Rao.
Thanks very much. So again, I think that the most important pieces of information that we've heard is that we are now seeing more adolescents and children with infection, and that one of the most important things that you can do now is to provide vaccinations for these age groups. So again, we can now offer vaccines to those who are 12 and above, and we know from a lot of the rigorous data that has been undertaken in children that it is a very safe thing to do. So just to go over the study that really helped to make this decision, it was a study that looked at about 2,260 children who were aged 12 to 15 that were enrolled in a randomized placebo-controlled trial. We know that 0 people who received the vaccine got the infection, versus about 1 in 50 who ended up getting the infection in the placebo group. So the trial also showed that the vaccine was extremely safe, as well as extremely effective. So again, I think I just want to iterate that really now is the right time to get our children vaccinated, and that we know that this is a very safe, effective vaccine with really extraordinary technology. Thank you.
So you have a 14-year-old, you have a 12-year-old, you're ready to run out and get it, you've seen all this evidence. Okay, how do I do it? Well, with Children's Hospitals with us today, they're making it available in Aurora and Colorado Springs. We'll put the website up there on how to sign up. You can also get a comprehensive list of who has the Pfizer vaccine available on this next slide. You can call our 800 number, or you can visit any of these clinics. Our major community sites, which is Ball Arena, Pepsi Center during business hours, Dick's Sporting Goods, the Ranch in Loveland, the Broadmoor World Arena in Colorado Springs, State Fairgrounds in Pueblo. The hours are listed. They have Pfizer, 12 and up, ready to go and get it done. We also have a mobile units across the state. You can check where they're at mobilevax.us/clinics. And you can also call 877-COVAX-CO to find one near you, or visit cocovidvaccine.org to find sites near you. It could be your local pharmacy, CVS, Safeway, your local hospital, community health clinic, children's, the large-scale sites. We want to make it easy for you. now that you're excited to run out and get it for your 12-year-old based on the scientific evidence that you've heard today. We're in a very different place than we were a few months ago, and we now have plenty of vaccine in the state. We are prioritizing making it available to everybody rather than using every dose of the vaccine that we have, because we have enough, and we want to make sure that there's no excuse not to give you the vaccine just because other people might not be lined up there or because it might take more than 3 days for that provider to use every dose. And look, the fight against this virus is essentially over for the 2.3 million Coloradans, including myself and many friends and family who've gotten both doses of the vaccine and have now had it 2 weeks after that. But until there's a vaccine approved for all ages, victory can't be declared, and the pandemic is still all too real for the many Coloradans who are not yet fully protected by the life-saving vaccine. We're making progress, building our comprehensive network of providers to make it easy for you to get the vaccine however you choose. We're putting doses on wheels. We're partnering with community health clinics. Yesterday, I even went to a clinic that the center put on with One Colorado where they had drag queens. So they had a drag queen clinic. And I also went to a Southwest Airlines clinic where you got free frequent flyer miles. So everything under the sun. I mentioned the bacon margaritas too. With masks no longer required for fully vaccinated people, it's more important than ever to really take this on yourself as a matter of personal responsibility to get vaccinated. If you've been vaccinated once, complete that vaccination with the second one. Don't worry if you've gotten one and you say, oh my God, I missed the date for the second. You still get it. You get it a week or two later. It will still work, right? Don't panic. You need to get it soon. Don't put it off months. But if you, oh, I missed the date, it was last week, should I still get the second dose? Yes. The second dose will work every bit as well. In fact, the window, I believe, is 42 days where they show that it should be fully effective in giving you the immune response you need to consider yourself fully protected from the virus. Stay safe, Colorado. Get vaccinated. Let's end this thing. Happy to take some questions.
The state is looking into requiring vaccinations for students 12 and up for the next school semester. And if that is the case, would it be kind of similar to the other required vaccinations where parents can opt out with a waiver?
Well, certainly the institutions that have required it, and we have a very local control state. So we have universities, for instance. Some of them are required it. All the universities that have required it have opt-outs in place for people who don't want it. I haven't heard that any school districts are looking at that, but if they did, they would also have that opt-out in place for parents who didn't want it. You know, what's important is that people get protected, and I think that most kids, as they're visiting their pediatricians and getting their shots, this is probably the most important shot to get. You know, is there a risk of tetanus and measles? There is, but the risk of COVID-19 is much greater at this point, given the prevalence of the pandemic in society. So I would get my kid vaccinated for COVID first. I think it's the most important thing they can be protected against right now.
Hi, Governor. Seth from the Gazette. 2 questions. One, can you talk a bit about why the change to the dose storage protocols? Are we seeing more doses being stored for longer periods of time? What kind of drove that change? And 2, this is probably for everybody. How concerned are you about the future of Colorado, future of the pandemic and COVID's presence here if we have sort of disparate vaccination rates in different parts of the state? What will that mean for us going forward?
To address that second one, can. So in the early days, we had much more demand for the vaccine than we had supply. So we made sure that every provider we worked with used every dose we gave them within 72 hours. And we strongly discouraged the wasting of any doses. We wanted to make sure that people were lined up if they punctured a vial and they had all 11 people lined up for Moderna as an example, ready to go, because we didn't want doses wasted. Now we have plenty of Pfizer, Moderna, and Johnson & Johnson. And the priority is now making sure that everybody who wants it can get it, and we don't use any supply constraint as an excuse. Meaning if there's one person that shows up to a small clinic, they should puncture the vial to administer the dose to that one person. And of course, if they can find others in the 5-hour period, depending on which vaccine it is and how it's stored, that they might have to do that, they should. But they in no way, shape, or form should feel guilty about about not being able to find a home for those doses because they were able to find a home for that one dose and that one person who otherwise would not have been vaccinated. So two, we have enough supply that we no longer have to keep the requirement of 72 hours every dose is used. That's one of the requirements that led Colorado to be one of the leading states in the early days in the top 10, 15 states in getting the dose into arms. Many providers now can have a week or two of supply on hand, and they have to have the storage for it, refrigerators, freezers, of course, that's all verified as one of our provider partners. But we want to make sure they have it where they need it, when they need it, and that's why we're going to making sure they use doses within 2 weeks rather than 72 hours. Who wants to address the second question?
Sure, I can take that question. So the first thing I would say in talking about, disparate rates of vaccination across the state and what that might look like in the fall, would probably be to turn to some of the data that we are collecting right now and have been sharing with you, which shows that we see a clear correlation between increased vaccination rates by county and infection rates by county. So as we see vaccination rates go up, we've seen case rates go down in those counties. And this is actually very similar to what we see with other infectious diseases, where we have communities where we have higher vaccination rates tend to be the communities where we have lower infection rates. We don't expect that there's a sort of magic threshold that we're going to reach that is going to absolutely stop COVID in our state. There always are going to be these differences in the level of vaccination that exists from community to community, but the reality is that the communities that have the higher vaccination rates are going to be the communities that have the most protection, especially going into the fall respiratory virus season.
Hi, Jason Grenauer here from Denver 7. A quick clarification for Dr. Hurley and then one for Governor Polis. Going back to your last slide, where there was a 50.6%, you were talking about hospitalizations. Is that the younger people have now made up that percentage? Can you just clarify that last slide for me, please?
Sure. So that slide was showing you a breakdown of cases that we would now consider that going forward would be considered vaccine preventable, hospitalizations that would be vaccine preventable. So that bluish color there is showing you hospitalization counts among 12 to 17-year-olds. The gray is showing you hospitalization counts among 0 to 11-year-olds. So those blue hospitalizations going forward, because vaccine is now available to individuals in those age groups, would be considered preventable through vaccination.
Thank you. And one for the governor, you kind of touched on it a little bit, talking about the different clinics that you went to, but given the plateau overall in vaccinations, have there been discussions about any kind of statewide incentives? Ohio did a lottery, New York is giving away lottery tickets, anything to come in Colorado?
There are many different incentives being offered, and we've the state of Colorado is giving. We're doing free Colorado Park passes. We've done through several radio stations. So, different folks want different types of incentives, and we are very excited to continue to work on that. But the biggest incentive for anybody should be to avoid hospitalization and death, and that should be enough for anybody to take the 15 minutes you need to get vaccinated and protect yourself.
Staff in the state who have been using Binax Now testing, Dr. Hurley, he talked about how important it is to get tested. Should people continue to use those tests, or should they find their local community site to get tested now that there's this little discrepancy going on with them saying that the state didn't pay them for the test?
If they're vaccinated, or what do you mean?
If they're vaccinated or just looking to get COVID tested in general.
Yeah, so so they're testing for different things, but certainly the easy Binax tests we are widely available. We've sent them out to many partners. You can get them from your county health. They are a very effective first-line test, but if you're experiencing symptoms, you should go and get the full PCR test with even higher accuracy rate, and that's also widely available. The Binax, I'll let the doctors talk, but effectively the Binax test, the false positives would be very, very low, but there are going to be some more false negatives in there because it might pick up an infection a day or two after a PCR test would pick it up. Dr. Hurley?
Yeah, I mean, I would say that there are definitely some better use cases for those Binax at-home type tests. A great use case for them is going to be serial testing that is being done on individuals. So testing every 5 days or so to ensure that individuals who may have ongoing risk of exposure are not going to work or another place infected. So that continues to be a good use of those tests. And we've been sharing information with our partners on how to best continue to use some of those Binax at-home tests.
Did that answer your question?
A little bit. I guess I was more so asking, like, does the state continue to trust Binax?
Sure. Yeah. No. It's. I mean, it has a lot of uses. It's quick. It's easy. You get the result in 15 minutes. it is less sensitive than PCR, and it might be a day or two later before an infection is picked up. PCR might pick it up quicker. We are not seeing in PCR or Binax false positives. It's very, very likely if you get a positive on Binax that you are infected with COVID. Very small percentage false positives on both of those. But it is a little bit less sensitive, but it is very useful as part of the testing arsenal.
Hi, Governor. John Daly, Colorado Public Radio. I have a question for Dr. Rao. Dr. Rao, how do you anticipate the rollout of the vaccine to happen regarding the approval and availability in Colorado for those under 12 in the coming months?
Yeah, so for our under 12-year-old population, there are some studies that are currently underway through some of these groups like Pfizer and Moderna. So they're currently enrolling children who are 5 to 12 years of age in various studies around the country. Colorado is participating in some of those trials, and they're doing similar studies. They're looking at the safety and how well the vaccine works in that age group. So they're going to be enrolling similar numbers of patients and are going to be following them up to see how infection rates look like in both of those groups. And so I know best case scenario, we could say that there could be approval by the FDA sometime in the fall. So it's hard to know exactly when that's going to occur, but I think optimistically sometime early fall.
Last question.
Hello?
Governor Charles Ashby from the Grand Junction Daily Sentinel. As you all know, of course, Mesa County is the only county that has the India variant, unless that's changed, unless somebody tell me that, which means that we now have the variant from 4 different foreign countries, including the state of California. But people out here are probably more concerned about the India variant because of what's happening in India right now. Can somebody there tell me how that can't happen here because we have better conditions, or we don't have the same conditions over there? And are you concerned, or any of your panelists concerned about the India variant coming out?
You want to do that?
Sure, I can take that question. So certainly we continue to be concerned about all variants as they emerge. We know that there are different types of variants. There are variants of concern where we have clear evidence that there may be some characteristic associated with this variant that makes it more transmissible or perhaps causes more severe disease or could impact vaccine effectiveness in some way. We're really still trying to learn more about the variants that have emerged in India and have been now spread in many states across the country and across the globe. So still more for us to learn there. We're really trying to understand if these variants that have emerged from India have concerning characteristics that will result in increased transmissibility or some of these other factors. So I'd say more to learn still, certainly concerned, tracking that data closely. We have increased the amount of testing that's occurring in Mesa County to make sure we have a good sense of what level of transmission is occurring there and what proportion of infections occurring there might be due to variants of concern or this India variant in particular.
And just to share some good news, the vaccines thus far are highly effective against every known variant of COVID-19. And that's important, and we hope that that continues, but it's certainly the case right now. Thank you all for joining us, Dr. Rao, Children's Hospital, Dr. France, Dr. Herlihy. I want to thank you all for joining us, and I want to thank the people of Colorado for listening.